Let's discuss the extraordinary vessels, diagnosis. The 8 extraordinary vessels supplement the system of channels and sangfu. They have a strong relationship to the kidneys and serve as a reservoir for Jing essence. When the body is weak, the treatment of the extraordinary vessels can help the human organism to increase Jing and strengthens the body. The extraordinary vessels are able to absorb pathologies from the 12 channels. If a surplus of a pathological factor is present in a channel, it can be transmitted to and absorbed by the extraordinary vessels and therefore help and protect the channels and the sangfu system. However, this transmission can cause the extraordinary vessels to be affected by the pathology. The 8 extraordinary vessels and their confluent points are the following. Dumai, SI3, Yang Chao Mai, bladder 62, Ren Mai, lung 7, Yin Chao Mai, kidney 6, Chong Mai, spleen 4, Ying Wei Mai, PC 6, Dai Mai, GB 41, Yang Wei Mai, TB 5. Diagnosis. The correct diagnosis plays a central role when treating the extraordinary vessels. The difficulty is that symptoms pointing to the extraordinary vessels disharmonies overlap with symptoms pointing to disharmonies of the sangfu organs and vice versa. It is important to differentiate problems of the 8 extraordinary vessels from problems of the 12 channels. In clinical practice, palpatory diagnosis is used to verify and determine involvement and disharmonies of the extraordinary vessels. Pressure pain at areas corresponding to the extraordinary vessels can be used as a reliable sign of extraordinary vessels involvement. The presence of pressure pain shows a disharmony of the extraordinary vessel, and the vessel should be treated. Example, the pain palpation and spinous process of the vertebra is a sign of Dumai disharmony. The confluent point of Dumai SI3 can be treated. If the patient complains about symptoms of vessel disharmony, then this information can serve as a further confirmation of the palpatory diagnosis and point to the treatment of the vessel. Example, a weak immune system due to lung qi deficiency and painful palpation on the spinous process of the vertebra is a clear indication for treatment of Dumai. The Dumai controls the yang aspect of the Jing. The treatment of Dumai is very effective to boost the immune system in chronic lung qi deficiency. Palpation can be used to confirm the treatment. Necessary and correct treatment of the vessel immediately reduces the pressure pain on the spinous process of the vertebra. Next, the treatment. The following approach is useful for the treatment of the extraordinary vessels. First, palpate the corresponding body areas and note any pressure pain. The presence of pressure pain indicates the necessity of treatment of the vessel and gives information about the side of the body that should be treated. First, the side on which the corresponding body area was painful and palpation should be treated. When palpating Dumai and Renmai, it is important to note if palpation results in a pain radiation on side or the other. When pain radiation on a certain side is present, then this side should be treated first. When no pain radiation is noted, that the practitioner can start treatment at either side. Treat the confluent point of the affected vessel. Third, check the associated body area for pain on palpation. If no more pain is present, then the treatment can be terminated. If the pain is just reduced but still present to some degree, then the confluent point can be treated again, or the coupled point can be treated. In addition, the treatment can be continued at the possible side of the body.